Imagine this, you're a patient who's about to undergo surgery. You're lying on the hospital bed with your heart racing, pounding, mind all over the place with all the what ifs. You could be someone like me who has never had surgery before and this is your first time. You want to trust the surgeon, but you can't shake the fear. Now flip the perspective. You may be the surgeon. Now for you, this is a routine procedure, but for your patient, it's far from it. What you say and how you say it can make all the difference between the patient feeling reassured and ready or terrified prior to a surgery. So in this video, we're going to cover how you can mentally and emotionally prepare your patients for a surgery prior to the procedure undertaking. Welcome back to my channel, everybody. Thank you very much for your constant engagement, feedback, and presence. As always, it's always a joy and a privilege to make these videos for you. So if you don't know who I am, my name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps healthcare professionals who come from English as a second language background become more empathetic, influential, and impactful communicators, collaborate with their patients, and consistently deliver patient-positive experiences on their way to achieving professional excellence. So if you are, say, someone who's doesn't speak English as their first language but understands it quite well and speaks it reasonably well too, so and regardless of which country you're from, whether you're from the Middle East or from Europe or South America or Central America or anywhere you are, and if you are working as a healthcare professional with patients day in and out, and you want to improve the way in which you communicate, relate, and collaborate with them, you have absolutely come to the right place. So I did mention this on my LinkedIn profile quite a few months ago that I actually had an accident in the Philippines when I was traveling there last year, which led me to actually fracturing my left clavicle. And I had to undergo surgery as a result of that. Now, I am someone who was actually hoping to go through life without ever having surgery, but I was disappointed, unfortunately. And I'm not gonna lie, it was my first time ever being under the operating table, and even though I have a mother who's a doctor, and I know people are in my family who've gone through countless surgeries. For me, it was, as an already anxious person and who absolutely hates hospitals and any kind of healthcare facility, it's a wonder why I'm even doing this sort of coaching or these videos. You wouldn't know, right? But yeah, that it was a very, very nerve-wracking and terrifying experience. And even though I kind of had a picture of what the surgery will entail and how it's going to look like, what's going to happen to my clavicle in order to fix it, and I understood all that, I had all these, you can call it irrational fears, that I'm going to not wake up after the anesthetic, and that's quite common. A lot of people now, especially if you're a veterinarian and you put a lot of animals under anesthesia, there's a lot of them, I've heard quite a lot of stories where they don't wake up, and this by no means is the fault of the veterinarian in fault. Sometimes the administration of anesthetics is quite challenging, and that is what I thought is going to happen to me. I thought that I'm also going to collapse in the operating table and never be able to wake up. I thought my entire arm, my left arm, is going to be ripped off of me, and I have to admit, just after surgery, I did feel that way, as if I didn't have a left arm whatsoever. So I felt like I was half naked, and I just had all these really, really irrational fears. But fortunately, I had an amazing surgeon who actually nailed this, what I'm about to cover in this video, very, very well. So not only did he go through, where the problem is in my left clavicle, but also what needed to be done in order to get it back to its normal shape and its normal fixture, and for it to be able to operate properly, what exactly the surgery will entail, what he will be doing, what the anesthetist will be doing, what the nurses will be doing, and at the same time, what I can expect a few days after the surgery, and also putting together a very good post-treatment plan. So he was absolutely amazing and incredible throughout this process. And I'm not gonna lie, I was still nervous despite him having gone through all this. And I remember having conversations with the nurses when I was on the operating table. I'm very nervous, I'm very scared, what do I do? What if this happens, what if that happens? And they all said to me, you are in good hands. This is not his first rodeo, he's done these many times before, so you will be absolutely fine. fine. So that again goes to show that collaboratively, it's not just the surgeon who's performing the procedure, but also the anesthetist and the nurse who were in question. They all worked together really well to give me that reassurance and also to really validate in many ways how I was feeling. So what they really did at that point was prepare me emotionally, if you put it that way. So they showed to me that, emotionally we know how it feels. We know surgery is never a pleasant procedure for anyone to undergo. It's not something that people consciously, or unless you're talking about elective surgery, this was far from elective, but still, it was something that people, if they had their way with, they would not put themselves through it, and it is nerve-wracking and it's very, very scary. However, they sort of understood, they could see where I'm coming from, and they were able to empathize with me. And at every point in time during, obviously I was under general anesthetic, but just after I'd woken up from it, everyone was asking how I'm feeling, is there anything that I need, and how was the experience for me? Not bombarding these questions one after the other, but they did it in a very, very compassionate, patient, and understanding and engaging way. So the emotional preparation that they provided me was absolutely incredible. The other thing that they really, really did, and I talk about this all the time on this channel, is they actively listened to me. So they were very, very open with all the fears and all the anxieties that I'd had about the surgery, and instead of jumping straight into the medical details, they actually posed the question to me: what are your main concerns? What is it about the surgery that worries you? And the response always was, you're not the first patient who has felt this way. It's very normal, it's very valid, and it is completely okay for you to feel this way. However, this is what the procedure will entail. This is what we will do to make you feel better. And also the fact that I had to obviously do my part, which was keep up with the work post-surgery, which was physiotherapy and a lot of exercises, so which actually led me to healing in about 2 weeks' time, very quickly. And the other thing that they also did was explain in very simple, reassuring terms. Now, say for example, you can be a doctor who can be saying, like, imagine we'll be performing laparoscopic cholecystectomy under general anesthesia using CO2 insufflation to improve visualization. Now, if they had said that to me, fine. I've got that little bit of a background in healthcare. I've got a mom who's a doctor, so she was with me doing all the consultations. So if they had said to me, different story. But with a patient who doesn't have the advantage that I do, that would be terrifying to hear. So especially with all the anxieties that they're going through. So at the same time, what you need to do is explain in very simple, easy to digest and reassuring terms what exactly the procedure would entail. So in my case, it was said that, this is how the x-rays is showing that your clavicle is looking like, this part is damaged. If this continues, these are the long-term repercussions. This could be permanently damaging your left arm. We need to do a reconstruction surgery that looks like this. So they used very good analogies, pictures, models, 3D diagrams, animations, everything to show me exactly what the procedure will entail. Now, for example, if you are, say, an internal surgeon, you can say, who's operating on a patient's digestive system, you can say something like, we're just going to remove your gallbladder using tiny incisions so that you can heal faster. You'll be asleep the whole time, and we'll control any pain afterward to keep you comfortable. My friend Michelle, she actually went through gallbladder surgery just at the same time when I went through my orthopedic surgery. So that was we sort of swapped notes, and that was a very good experience that sort of brought us close together and brought it on. And she again said that the explanation that the doctors gave her was amazing, and she also recovered very, very quickly. And like I just mentioned previously, it's very important that you demonstrate, show, illustrate, not just explain to them, say verbatim and just do a big word vomit and do a verbal diarrhea about what how you're going to actually carry out the procedure and what it's going to involve. Simple diagrams, hand gestures, make sure that there's labels on all the diagrams, even a quick simple sketch. If you have a 3-dimensional model, very good. My client Farida, who's been working with me for the last month, when she's performing any kind of ophthalmologic surgery, so in the eye, she always shows all of her patients, this is what a normal eye looks like using a 3-dimensional model. This is how how I'm going to do the surgery. This is how your eye is going to look like afterwards. That's something that we had to work on together, to how to make the explanations very simple for her patients, and she has done an amazing job with that. And the other thing I would absolutely say that the surgeons in my case who worked with me, who did that, is what they did not dismiss my anxiety. They actually very much normalized it, like I said previously. So instead of saying, oh, don't worry, it'll be fine, you can a better way of saying that shows that you actually care about the patient, and also you are validating and reassuring them effectively, is that you can say something like, I completely understand it's normal to feel nervous before surgery, but I want you to know that this is a routine procedure for us. We do this every day. It's our bread and butter. Our claim is here to provide you the best care, and you're in good hands, and we will take good care of you. So acknowledging the patient's anxiety goes towards the first step in actually easing and healing it. And it goes without saying that you have to have a really good, positive, welcoming and empowering body language. So things like, having a lot of eye contact, having a very steady, calm tone of voice, and also speaking very slowly, again, taking a lot of pauses, making sure that they're also participating in the conversation, and again, you're sort of giving them a voice and advocating for them as much as possible. And not to forget that you should end every operation, or preparing for every operation before that, is that your last words before you undertake a surgery absolutely matter for the patient. So that is what the patient will remember, and they will drift into as you go into anesthesia. So you're in good hands. My team and I are committed to giving you the best outcome and make this experience smooth and safe as much as possible. We will see you soon. So instead of, you need a little bit of luck, so you can say good luck, but at the same time, it's your responsibility as a healthcare professional to make sure that you are doing everything in your power to verbally and otherwise reassure your patient that they are indeed in good hands. So just to conclude, being a great surgeon isn't just about the skills in the operating room. It's about how you make your patients feel before you get there. So even if you're, say, a veterinary surgeon, or say if you're a surgeon of someone who is quite elderly and you are having to speak to their support workers or their caregivers about it, it should be no different. So you have to be the voice for the people who can't actually speak. So it's important that what the patient will remember just before they go under the knife is what they're going to remember for the rest of their life. So all of these steps and strategies will really go a long way. And remember that you're not just preparing patients for surgery, you're building trust that lasts for beyond the operating table. And now I would absolutely recommend my orthopedic surgeon to anyone and everyone who is about to undergo a similar procedure. So hopefully this has given you some tips and tricks, whether if you're in the surgical space, and how you can work better with patients who are going to go under the knife. To stay tuned for more content on communication in the healthcare space as an healthcare professional, make sure that you hit the subscribe button and the notification bell. Leave this video a like. Leave your comments, thoughts, and feedback down in the comment section. And as always, thank you very much for your time, attention, and presence, and I will see you next week.